I'm Rusnė, a behavioral sleep specialist and also someone who's been through insomnia myself. I know what it's like to lose trust in your sleep, and that's part of why I do my work. I help people who've been dealing with long-term insomnia, so not just a few bad nights, but months or years of bad nights. If that sounds like you and you've already tried all the usual things like melatonin, podcasts, meditation apps, quitting coffee, new mattresses, pillows, or magnesium, and they didn't work for you, then you're in the right place. What I do is I use an approach called CBT-I, Cognitive Behavioral Therapy for Insomnia. It's not the usual talk therapy, and it's not meditation or hypnosis, and it's definitely not sleeping pills. CBT-I is a step-by-step approach that helps you fix the three main things that control your sleep. So your body's need for sleep, how you naturally feel by the bedtime, your internal clock, when your body expects to sleep and wake up, what your brain connects with your bed, especially if lying in bed now makes you feel wide awake, anxious, instead of sleepy. So what does the process look like? Well, we start by having you keep a simple sleep diary for a week or so. This helps me see exactly what's happening with your sleep. Like if you're waking at similar times every night, or it takes you hours of tossing and turning before you fall asleep, or perhaps if your sleep problems are worse on certain days than others. Importantly, each session builds on the last. Through those sessions, we make changes to your sleep schedule, like adjusting your bedtime and wake-up times. We also address worried thoughts that you've probably developed about sleep, like I'll never fall asleep, or I need 8 hours or I'll be a mess. And we also work with your body's natural sleep timing, and I teach you relaxation techniques to help you wind down at night. But it's always done step by step and based on what your sleep system needs. Keep in mind that sleep is a survival need, so your system will resist change at first. That is normal. You might also feel more tired than usual before things get better, but that's also normal, and for most people who stick with it, sleep becomes more predictable, less stressful, and finally it does let you wake up more rested. This approach is for people with chronic insomnia, as I said, meaning 3 months or more of ongoing sleep problems. And it works best if you are ready to take an active role, if you're willing to track your sleep, and you can stick with a plan for a few weeks. It's probably not the right fit if you're in an acute mental health crisis, or you're dealing with high levels of anxiety, or you have untreated trauma, psychosis, bipolar disorder, or unregulated nervous system issues. Also, if you're hoping for a quick passive fix, this is not that. CBT-I isn't a diet, and it's not a hack. It's a proven approach, and it takes a lot of effort, and it asks you to follow through with the changes even on the nights and days when you don't feel like it. Most of my clients need around 5 sessions to see real change, and that's the course structure. After that, we talk. Some people continue for a few more sessions, especially if they're tapering medication or need more support. Others feel stable and continue applying the things they learned on their own. We decide together what makes sense from there. Either way, the goal is the same: to get you back to solid ground where sleep isn't a fight and you know how to manage it long term. I've been through this process myself, so I don't take it lightly. If you feel ready to work on your sleep, the booking link is below. And if you're still unsure, please take your time. This isn't easy work, but it's possible, and you don't have to figure it out by yourself. Thank you for watching, and whatever you decide, I hope your sleep gets better for good.